We're back on Check This Out Houston from Goodwill Houston corporate headquarters. Occasional heartburn is normal, but if you're experiencing the painful burning sensation 2 to 3 times a week, it might be time to see a doctor.
Acid reflux disease, or GERD, gastroesophageal reflux disease, is the problem with gastric content refluxing up into the esophagus.
For many, it's a very painful disease that can be debilitating.
I had no energy. I'd stopped going to the gym just because I was so tired. Started gaining weight.
And unfortunately, for many, it's a disease that oftentimes goes misdiagnosed for years.
In college, I started vomiting every single morning and did that for about 20 years. I wake up within about 5 minutes, would just throw up bile. Once again, thought that was normal. After college, started working, kept getting worse to the point I would wake up coughing, fire-breathing dragon type feeling, just very uncomfortable if I ate anything even slightly spicy. I would wake up 2, 3 in the morning and couldn't stop coughing for about an hour. I've had my gallbladder checked, I've had everything else checked, still could not find anything.
It's a very serious disease that, if left untreated, could lead to serious health problems.
Untreated acid reflux disease damages the esophagus or the food pipe. And this damage ranges from mild motility issues, like you start having problems swallowing food, all the way up to developing cancer of the esophagus.
Symptoms can include heartburn, food regurgitation, excessive burping, and even feeling bloated.
When acid reaches up to the throat area, you start having cough, sore throat, hoarseness, and other symptoms of this nature. We do have a subcategory of patients who have silent reflux or laryngopharyngeal reflux. And these patients do not have the typical heartburn and food regurgitation, they simply have throat-related symptoms.
Like patient Ann Osaba.
I had seen an allergist and they told me it was just allergy related. They'd give me steroids for the persistent cough that I developed, and it would go away for a few days, but it always came back along with the burning sensation.
Both Ann and patient David Gordon thought it was something they would just have to live with for the rest of their lives. Until they found Dr. Elias Darido at Houston Heartburn and Reflux Center.
I finally felt heard. You know, I kind of felt like I was shoved aside for most of my life, being told that it's either in my head or, you know, oh, this is just the way it is, and just never felt that way. And so having somebody actually listen and be like, nope, nope, you have an issue and I have a solution, was very, very helpful. When you lived with something for 20, 25, 30 years, sometimes seems a little bit too good to be true, but it's not.
Houston Heartburn is unique in that it is a concentrated center specializing in heartburn treatment.
I have decided to open this clinic, and this was relatively a new concept, to dedicate a whole practice just for heartburn. One, because heartburn is a common problem, and we start with a comprehensive history. We would like to understand all the symptoms the patient has been having and all the testing that they have done. What is their response to medications? What's bothering them the most? The second step is the workup. The workup is crucial to the success of treatment. And that's why we have decided at Houston Heartburn to do this workup in one single place by one single person, so that we do not have to resort to different physicians in different places and have to wait 3 months to complete a workup. Our workup will be completed in 1 day.
From there, Dr. Darido can determine which treatment is necessary.
So we offer the whole spectrum. The treatment can range from lifestyle changes up to the surgery, which is the Nissen fundoplication. The surgery restores the anti-reflux barrier. It restores the normal anatomy. It's very effective. It's minimally invasive, so patients will spend 1 night in the hospital, and they will go home. They can go back to work within 5 days after surgery.
Both patients say it has changed their lives.
Since surgery, no more reflux, eating more normal. I have not actually gone back to anything carbonated, but don't miss it at all. And I can definitely enjoy a lot more life, being able to wake up, get ready, go to work, I know that for most people it's an average day, but for me it was a lot more difficult, and now I am average.
Anne had the surgery in conjunction with a gastric sleeve.
The relationship between acid reflux disease and being overweight is very tight. Almost 80% of overweight patients have acid reflux problems. And to treat acid reflux disease in an overweight patient, you have to control the weight, in addition to restoring the normal anatomy, fixing the hiatal hernia, reinforcing the sphincter.
She says the heartburn went away immediately.
I can remember that first night I woke after the surgery, being in my room, realizing I hadn't coughed at all. I wasn't hurting. I think I started to cry just because I knew that wasn't going to be my norm anymore. And I was going to be on my way to a healthier lifestyle. As a mom of 2 boys, I have more energy to keep up with them. And I've lost over 100 pounds. So it's been a huge, wonderful change.
For more information, check out HoustonHeartburn.com. That'll do it for this edition of Check This Out Houston from Goodwill Houston Corporate Headquarters, where we have a new group of employees about to head out to Goodwill jobs across the greater Houston area. If you want more information on Goodwill Houston or anything you've seen in our show, you can go to checkthisouthouston.com or abc13.com. Until next time, I'm Kat Cosley. Thanks so much for joining us. Check This Out has been brought to you by Goodwill Houston, Dirt-Free Carpet and Upholstery Cleaning, Houston Heartburn and Reflux Center, and Katie Furniture.